Hi, I'm Bob Schrupp, physical therapist.
I'm Brad Heineck.
We have our sides.
Yeah, I'm normally on the left.
And together we are the most famous physical therapists on the internet.
In our opinion, of course.
And Brad, today we're going to talk about something really more kind of what they say is inside baseball. This is information that therapists know, but you have exposure to this as a patient when you have a knee replacement.
Right. If you've got a total knee replacement, the numbers that you get from this are very important to you because a doctor has told you we want to get you to 90 degrees is our first goal. And most people don't have a clue what they're talking about, but they say, okay, but that number sticks in their head and they want that 90 degrees. And then we come up as therapists and say, I'm going to grab my goniometer and measure your knee. And then that term throws the person off even more.
Right.
So you got a knee, you're kind of wondering about what 90 degrees is, and then a goniometer is going to come over and take measurements. And
So if you had a knee replacement, we're going to kind of give you the basics on,
Right.
on measuring here. So first off, as Brad said, we use a goniometer. We can break this word down like you can always break words down. Goni here actually means joint, and meter is measure, so you're measuring the joint. Very
Right.
simple. We can use this for measuring all the joints, not just the knee. Do you know what the other name for this is? Professional name for this?
No.
You don't know that, do you?
No, I don't.
It's a linear protractor. Yes?
Oh, give me a
Yes,
it's a goniometer.
It's a linear protractor.
protractor.
That's what the professionals that are in the field call.
Well, yes.
So I already rolled up my pant leg here, not to just show off my calves, which I don't have much, but we're going to show the goniometer and how we can use it to measure the knee.
Okay, so with the knee, after you get a knee replacement, there's two big things you want right away: 90 degrees, but also 0 degrees,
0 degrees.
for full extension.
Right.
So, Bob, why don't you go to 0 degrees?
Okay.
Now, this is something you will not be able to do right away. Well, like this, you might be able to. If you're doing good after knee replacement, you'll be able to put your leg like this, and you'll get a straight knee like it was prior to surgery, or hopefully it was.
And that's 0 degrees.
Right, so I'm going to put this, now you're not going to be able to see the numbers on the goniometer, but right there is 0 degrees, it just means you're straight. You got a nice straight knee.
There's no bend at all. That's 0 degrees of bend.
And then what will happen is with most, in most hospitals, they're going to have you do something called scrubbing the floor. That's going to be outdated pretty soon, as you'll find out on our website. But they usually put a rag down on the floor and they go back and forth like this. And oftentimes you get about this far and your knee starts to hurt. There's considerable pain, so you stop doing it. And that's fine.
Why don't we measure that, Brad?
Yep, let's measure it. Are we close to 90 degrees?
Yeah.
And it's not percent, it's degrees, because a lot of people say, how many percent am I? Just a small thing, but right there, okay. All right, Bob, what do you got?
That is 64 degrees.
Okay, 64 degrees, so
We're quite a ways away
26
from
degrees to go yet.
right from 90. Now 90, most people do know 90 is a right angle, don't
Right,
they? 90,
yeah,
90 degrees
so-
is an extreme, just an absolute right angle. That's 90 degrees.
Right there.
So now let me get up to 90. That must be 90 right
Yeah,
there.
I would say we're very close
Very
to 90.
close.
All right. Okay, so I think we're actually past
Yeah, we're past 90 already. This is 97.
97.
So
What's normal range of motion? If you got a total knee replacement, people say, how far is this going to go? You know.
well, normal range of motion is, and they have different normals. There's different depending on who you read, but it can go up to about 130, 135, 140, maybe even 150.
Well, that's if you're young and
Yeah, you're young.
But if the people are in our age group and after knee surgery, boy, if I get them to 110, you're doing.
That's
pretty
usually
darn
our
good.
goal is 110.
Yeah.
Sometimes you'll see 115, but it's rare.
I just finished one this week. He was rare. He was 66 years old. He got 125.
Wow,
But it was
that's unusual.
It was an amazing recovery. He didn't need much therapy either. So most people you're not going to see that.
We shoot for 110, which is, can we get the goniometer,
Sure.
Brad? We can see about where 110 is, and you can see visually what it looks like. That actually is 110 right there.
You're good, Bob.
I'll go a little bit farther. That's 110 degrees. What's nice about that is if you get to 110, now you can get out of a chair pretty well.
Right.
Because
Right.
there's enough bend in the knee. If you've ever tried to get out of a chair with your knees straight,
Yeah, it's like
it's very difficult to do. You need to have your knees bent and you need to be able to lean forward like this, nose over the toes as we say,
Yeah.
in order to get up out of the chair. If you don't, if you try to get up straight like this, you just can't get
Right.
out. So that's a very functional limit. That's 110 degrees. You can see visually what it looks like now.
Right.
That's the goal we're gonna be looking for. It is degrees, it's not percent.
Right.
You said, as Brad was saying earlier, when we were talking about this, that a lot of patients come going, well, I'm at 50%, or I'm at, and what they really mean, they were at 50 degrees.
Right, exactly.
So,
So yeah, that's the goniometer knee measurements, particularly with knee replacements. Have it so you feel comfortable about it, and let the therapist do the measuring.
sounds good.
All right, so if you're 40 and over, you might have a knee replacement. The
Yeah.
closer you get, and
You're going to want to subscribe to us, because we're going to help you stay healthy and fit well into your elder years.
you better believe it. And if your parents are getting knee replacements,
Yeah.
Yep,
You
take
want
a
to get
look at
involved,
this.
and you can know what's going on in their life.
that's enough then, Bob.
All right.